Hello, it's Dr. John Kirk again, St. Helena Women's Health Center. We're back here talking about menopause, the good, the bad, the change of life. Probably both men and women go through some form of menopause. We'll call it menopause for the men and menopause for the women. I'm not quite sure of the menopause, but maybe that's because of menstruation. Well, what is menopause? It's actually a day. It's one day. It's the last day that you had a period. Whenever your last period was, and you never have another period, that is your menopause date. Now, it's not the same thing as the symptoms of menopause. The symptoms of menopause, as many of you know, are hot flashes, sweating, waking up at night, flushing or turning pink in the face, not thinking as clearly as you used to, having some struggles with urination or dryness in the vaginal area, or the skin in general. Some people feel like they are losing their hair, gaining weight. Literally multiple hormonal changes and diminished estrogen are causal of all of these types of symptoms throughout the whole body. Interestingly, every cell in the body has estrogen receptors. That means the estrogen that women, men also, produce through their ovaries in women is able to be used in any cell in the entire body. And amazingly, when you don't have estrogen, not surprisingly I should say, you have these symptoms. That's the effects of menopause. And another new term, perimenopause. And perimenopause is really what the issue is. Perimenopause means near menopause. And you'll still have your periods. You're not menopausal if you're having your periods, but you're going to have symptoms, all the ones we talked about above, and they can last for 3, 4, 5, even 10 years before you actually stop having your periods. And once you stop having your periods, sadly, the symptoms don't necessarily go away. In fact, sometimes they can get worse because the estrogen has really kind of shut off for all practical purposes. There's still estrogen, but it's very, very limited. Another interesting thing about menopause is it's the rate of change in the hormone estrogen that seems to cause the effects. It's not necessarily just that you have low levels of estrogen, but rather that you go from higher levels or normal levels to low levels very quickly and much more frequently when you become menopausal or perimenopausal. There's less of a natural curve going on, a normal amount of estrogen, which goes up and down every day in everyone who have, both men and women frankly, but in everyone who has menstrual periods, for example, there's a natural curve of estrogen over the cycle of that month. And when that becomes much more variable, for example in pregnancy, significant swings of estrogen, much, much higher than any other time in your life, you can also get hot flashes and some of the symptoms of menopause because of the rapid changes that can occur during that time. Very interesting. Even birth control pills will give some women menstrual-like or menopause-like symptoms because of the changes that they have during the time that they take a pill, and then the levels go down over time, and then they take another pill and it jumps up, and then they go down over time. And for some women sensitive to those changes, they'll have symptoms of menopause even at that time in their life, even in the 20s. So not a big, scary, terrible thing, but what options are there, and what kinds of things can we think about? Well, first of all, menopause happens at around 51 years of age. That's changed over the years, but for the last several years, it's been 51 years and a few months on average. It does run in families. So if your mom had menopause much earlier, it's more likely that you will. It's not a guarantee, but it's more likely. If she had it at 57, well, you may be having your periods for a little longer. But at the end of the day, menopause doesn't have to be a bad thing. Imagine, you can't get pregnant, you don't have any more bleeding, you have to worry about pregnancy. And at the end of the day, it's kind of easier in some respects, right? But those symptoms take their toll. And there are many different things that we can do to treat those symptoms, and the other side effects like bone density problems. Broken bones later in life are often caused by osteopenia or osteoporosis, which I'm sure you've heard about, and we'll talk about more in a future segment. But when estrogen is depleted, estrogen, like I said to you earlier, is needed for every cell in the body, and one in particular is the bone. Bone requires estrogen in the process of laying itself down and growing, and without estrogen you won't create any quality bone. So those women who have been on certain medicines that block estrogen, like Depo-Provera or Lupron, for those of you who have heard of those medicines, those are birth controls and a medicine to help treat, among other things, endometriosis. They actually block, the way they work is they block estrogen, but they take a toll on the bone. And so there's significant issues as we get later in life because of the absence of estrogen. So there are many things that we talk about in terms of menopause and its effects. You've learned about the date that menopause occurs as your last period, when it happens on average, and the fact is that it affects most of your life. Some good, some not so good, but we have treatments for you, and we'll talk about those treatments in our next segment. You have a blessed day, and thanks for joining us today.